CAO Helmer, is there an intention to finish this agenda? Like, we're going to get through this whole regional hospital district in one go?
Thank you, Chair. I think that there's a reasonable probability that we could successfully achieve that, yes. If we're able to, yes.
Okay. And I don't see a point on the agenda where we close. So are we meant to do the closed right after?
I apologize. We did have a section to go into closed and it's not on here. So yes, that was the intention.
Okay, so we'll close before we adjourn. We'll reopen and then we'll adjourn. Then we'll call the other directors back and we'll carry on with the open until 4 o'clock. Go ahead, Director Clark.
Thanks, Chair. So when we approve the agenda, perhaps we could add that closed meeting in right after the director's notice of motion.
Okay. Thank you.
So I'm still waiting for confirmation that we're okay, we're up and running on the website. Thank you.
Okay. I'll call this meeting to order and recognize that collectively we are on the unceded territories of all the First Nations within our regional boundaries, and we are grateful to be here. Could I have someone move approval of the agenda with the addition of the closed section of this meeting under 13.1? Moved by Director Elliott, second by Director Rainbow. I'll call the question. Is there anyone opposed? Motion carries. And could I have someone move 3.1, which is the order of M192, moved by Director Rainbow, seconded by Director Jewett. Is there anyone opposed? Motion carries. Thank you. And now, is Dr. Cranston here? Okay, great. And we have Ms. Campbell here to facilitate the presentation for him. Thank you. Okay, welcome, Dr. Cranston. We can see you are here. We'll give you a minute to get yourself live and on video.
Yeah, can you hear me there?
We can hear you. We can't see you.
I'll remedy that.
There we are.
There we go.
There we are.
Probably better just hearing me. Thanks everybody for allowing me this delegation. I'm James Cranston. I'm a physician in Squamish, the co-lead of the emergency department there, and the lead of a project to try and obtain a CT scan for Squamish. Can we start my presentation? I can't see it.
Yeah, we can see it now.
Perfect.
Perfect. And
Very
off you
good.
go.
That's great. Thank you. So this is a view from Squamish General Hospital back when we used to have a helipad, which unfortunately we no longer have. And maybe I'll be coming and talking about that in future years. Next slide, please. Just very quickly, I'm a physician in Squamish. I grew up in Calgary, have a university education there, did a degree in zoology, was a school teacher, did a master's of education, did medical school, University of Calgary, residency in Vancouver, and then moved to Squamish in 2009. I've been working here ever since in Diamond Head Medical Clinic in Squamish and the Squamish Emergency Department, and I plan to live here for life, which means that I've got a lot invested in the community, and I really would like to see our little hospital grow. And what we're about to talk about today is the most important part of that growth. Next slide, please. So in short, just a very quick introduction to what is a CT scanner. Well, a CT scanner is the difference between what you see here, which is a normal abdominal X-ray. Next slide. And what you see here, which you'll have to take my word for it, is obvious acute clinical diverticulitis. And this makes the difference between a patient being discharged home or a patient being treated for acute diverticulitis. This is a real case that I've seen. And this patient had a misdiagnosis and went on to have a Hartmann procedure, which is bowel resection with a colostomy for 6 months before their colostomy could be reversed. This was easily treatable with antibiotics if the diagnosis was made. CT is a very important part, not the only part, but a very important part of that diagnosis. And without a CT, it's inevitable that we are going to miss more diagnoses than we would certainly if we had a CT. Next slide, please. So how important is a CT? Well, in 2021, a CT is a standard of care in every emergency department in North America. Squamish is by far the largest population center in BC not to have a CT. In fact, most population centers over the size of about 10,000 have a CT in BC. So we are the largest one to not have one. It's very fair to say that practicing medicine without a CT is quite literally like practicing medicine in the 1980s before CT was available. Next slide. Can I have the next slide, please? So there are multiple effects. Back one slide, please. Multiple problems of not having the CT. The demonstration the example I gave shows that we are going to have an increased number of misdiagnoses, and we have had an increased number of misdiagnoses than we would have if we had a CT. We also have delayed diagnoses, and both of these things lead to increased morbidity and mortality. Secondly, not having a CT means that we need to rely on Lionsgate Hospital in acute setting for CTs. Patients are often transferred down to Lionsgate and then they have no way home. So they're sent down in an ambulance and then they're stuck down there until they can get back. And thirdly, not having a CT in the community requires patients and or their families to drive either to Lionsgate or to Whistler to have outpatient studies done. A lot of time for a lot of people that's either very, very difficult or impossible. Next slide, please. Not only does it affect the community, but it also affects the hospital. It has a number of downstream effects, including increased utilization of ambulance in the corridor. And as many of you may know, there's already a shortage of ambulances in the corridor. It increases nursing shortages is because oftentimes these patients are quite ill and a nurse is required for the transfer. It requires a lot of physician time, especially in the emergency department, to coordinate care with radiology at Lionsgate Hospital or with the emergency department at Lionsgate Hospital. And it takes a lot of our clinical time away. It also takes away some of the clinical time of the emergency department physicians at Lionsgate. And lack of CT is very literally going to prevent us from recruiting general surgery colleagues or medical specialists to this hospital. When I first started at Squamish General Hospital, many of you will know that we used to have 2 general surgeons. Back in the 80s and 90s, when these guys worked, it was quite normal to work without a CT scanner. In the 21st century, though, there are no general surgeons who are comfortable without working with a CT. So there's no way that we are going to be able to grow our hospital in terms of the number of specialists without a CT. Next slide, please. So why I've asked for and been granted this delegation is to ask for 2 things from the Squamish-Lillooet Regional District. First of all, we need advocacy. We need the SLRD to advocate for us. We need your voice to help us force VCH to meet their responsibility to provide quality care in the SLRD. There are a number of groups already on board. The Squamish emergency physician group is advocating for this. We have the support of the Squamish MAC. We also have the support of radiology at Lionsgate Hospital. We have the support of the emergency department at Lionsgate Hospital, and we have the support of the medical advisory committee, so a group of all the physicians at Lionsgate Hospital. Unfortunately, we don't have the support of VCH themselves, and that's what we need at this point. The second thing that I'd like to request is funding. We're going to attempt to raise the capital to purchase and house the CT, to apply further pressure on VCH to fund the operation of the CT. That's advice that's been given to me from others that have held similar projects in their communities and in their hospitals. Next slide, please. That may actually be the end. I'd like to open the floor up to any questions.
Great, thank you. Are there questions? Director Rainbow, go ahead. And then Director Richmond.
Thursday. Well, Dr. Cranston, nice to see you here.
Hi, Tony.
What's the cost involved here?
So there's two costs associated with it. The first is the purchasing of the machine. Lionsgate Hospital just purchased a second CT scanner for their hospital, and the cost came in at approximately $1.5 million. The second cost would be housing the machine. There is an area in the hospital that we could use if we were to be able to clear it up, but that's not a guarantee. Otherwise, we would need to build housing. I would make a rough estimate there of $300,000 to $500,000.
Okay. Director Richmond, go ahead.
Thanks, that was my question.
Okay. Great. Any other questions for the doctor?
So if we said $2 million, that would cover.
That should be more than enough. And then at that point, we would rely on VCH to fund the operation of the scanner.
Thank you.
Okay. Go ahead, Director Elliott. And then Director Mack.
Dr. Cranston, who have you spoken with within the VCH system?
So far, I have spoken with Andrew Thompson, who's the head of radiology at VCH. And I've also spoken with the director of diagnostic imaging, which I understand is actually an entity outside of VCH. And then finally, I've spoken with Sean Parr and Peter Edmonds. Sean Parr is his title, I believe he's the assistant director of Coastal at this point. Karen, you can probably correct me if I've got his title wrong.
Yeah, he's the interim COO for Coastal. And then obviously the Sea Sky Regional Hospital District Board isn't providing $2 million, but what are your other fundraising targets?
So I've been provided with a list of potential private donors locally that we're writing letters to, mostly including developers. And there are some other local fundraising groups like the Rotary Club that have been in contact with me that I need to connect with to try and raise that way.
Great. Thank you.
Okay. Have you connected with Sandra Cameron at the Whistler Healthcare Foundation?
I haven't yet, but that is something I will do as well.
Okay, great. Any other questions? Go ahead, Director Stoner.
Thank you, through the chair. Dr. Cranston, I'm curious if you have a sense of what VCH's current hesitancy is here. Is it the capital funding? Is there some concern around the operational funding from their perspective? Do we know?
Speaking with Sean Parr, I think it's primarily the operational funding that's the issue. I think that they're probably expecting that we will be able to come up with the capital funding, but they just do not want to commit at this point to the operational funding.
Okay, any other questions from anyone? So, yeah, go ahead, Director Elliott.
Well, maybe just for Dr. Cranston's benefit, have we explained to him the cycle that we go through for making budget decisions and the timing?
Yeah, that's what I was just going to
Okay.
ask Director LaFrance if you could hit the tops of the waves on how we can put this into our future budget planning, or at least the placeholder, not for the full amount, but just how the process would work for the ask. Sorry to put you on the spot. You can come back to us.
Yeah, sir, I don't think there is a process. The board would have to advocate for the project, and then we'd have to try to fit it in the budget. So our budgets are basically starting in January for that year's budget, and they're approved by March 30th, 31st of that year. So during that time, we discuss the taxation levels and future projects. And so during that time, we'd look at what we have in reserves, what we would be able to afford, and then build a plan.
And in the meantime, you know, at the board level, we can make the advocacy as you've requested. We have regular meetings with Vancouver Coastal Health, with Sean Parr and with other members of their team. We can certainly help connect with various donors and funding sources, and help to make the case for it. Go ahead, Director Stoner.
I wonder if we could be formalizing that in a motion for a letter of support from the chair to VCH for this ask, and that we refer the budget request to the 2022 budget.
Yeah, I think we could probably write a letter in support in principle of the project without specific numbers attached at this time. And then as we go through the process and Dr. Cranston refines where the funding is coming from, then we can revisit. Maybe we'll have you back at some point when you've got some more information. Would anyone like to make that motion? Moved by Director Rainbow, seconded by Director Jewett. Any further discussion? Okay, I'll call the go ahead, Director Elliott.
I just want to say I think this is such an important initiative, because if we don't start investing in Squamish General Hospital, we will by default be forcing everyone to go down to the city. And, you know, as someone who has a spouse that gets patched up regularly, it's very stressful when you're facing the decision in the emergency room about whether your loved one has to go down to the city. And so I think this is an idea whose time has come, and we do need to advocate through the master planning process that we know is unfolding this spring, as well as, you know, as chair and vice chair of this committee to VCH to make this happen. We need to be a really, you know, modern, you know, medical facility for the Squamish-Lillooet Regional District. That is critical.
Agreed. Director Rainbow, go ahead.
I agree with everything that Karen said, and I'm reminded of the experience we've had with VCH over the last 3 or 4 years. We've said very strongly to them, stop coming and asking us to buy lead pipes and toilets and new windows and that kind of stuff. And we want to have a say in how money is spent in the Sea to Sky and what happens at Squamish Hospital and at Whistler. And I think this is a great example. It's a great project to get behind and to really, really hammer them with it. So this is something that we really need, that we really want, and use it to get that message through to them that we're not just a rubber stamp organization for them, for what they tell us they want. That we're an organization that's going to bring things to them that we think are important to us. So I fully support the idea of the letter and everything else.
Thank you very much. Any further comments? I'll call the question. Is there anyone opposed? Motion carries. Thank you very much, Dr. Cranston. We appreciate your time and your advocacy on behalf of our community, and we look forward to seeing you again really soon.
Thank you. We'll speak again.
Okay. All right. Moving on, we are at 5.1, which is the minutes from the meeting of February 24th, 2021. Could I have someone move approval of the minutes? Moved by Director Elliott, seconded by Director Jewett. Is there any discussion? Call the question. Is there anyone opposed? Motion carries. Is there any business arising from those minutes? Seeing none, let's go on to the CAO verbal update.
Thank you, Chair. Nothing to report.
Nothing today. Okay, thank you. And then we have a delegation from Mr. Fripp regarding our audited financial statements, but he's not set to go until 3 o'clock. Am I correct on that?
Thank you, Chair. That's correct. So that's separate from this.
Okay, I'll do my 8.1 verbal report. Just to share some work that I've been working on. As everybody knows, vaccine clinics are moving along. We have weekly calls with Vancouver Coastal on how these vaccine clinics are being conducted in various communities. There has been some concern raised from a number of residents in electoral areas that they don't have clear understanding about where they can get their vaccines or how they can register. So I've been on the phone with Sean Parr over the last day or so and with a couple of citizens, and it's been confirmed that residents in areas C and, basically, if you don't live in a municipality, you can register in your nearest municipality. So, and they've updated the postal codes to allow for registration from Britannia Beach and Furry Creek, and to go to, primarily they prefer if people can go to their nearest pharmacy to do that because it's the quickest, but certainly registering for your nearest municipal clinic is also welcome if you're eligible by age, and they are moving quickly on that. So it seems as though the registration, you get a call back for your appointment time, and it moves along. And then the only other piece that I wanted to mention in this verbal report is that there's a mammography clinic coming to Whistler on May 3rd to 5th and May 10th to 12th. And I think we will I will definitely share that information with all of you, and I hope that you'll share it with your networks because getting a mammogram is important and you can't wait. So let's get people out to those clinics if they're eligible for those. And go ahead, Director Rainbow.
Yeah, just wanted to follow up on what you were saying about the clinics. Mo and I both qualified by age, and back in March we were able to call in. The only problem we had, and it's a minor problem, was that the person doing the dispatching lived somewhere, goodness knows where, and didn't have a clue about this area. So she wanted to send me to Seashell. And then I explained to her I wanted to go to Squamish, and she said, well, no, there's no availability there. But we had a little chat, and she sorted out that this 55 centre was in fact in Squamish. So I think, and I'm sure they've ironed some of that stuff out now, because that was right at the beginning of it. But and when we actually got to the centre in Squamish, I just want to make this comment. The organisation there was fantastic. The whole thing, from the time you arrived at the door and were greeted and checked and this, that, so moving in and getting shot, and having a rest, it was really, really well done. And I wouldn't anticipate hearing too many complaints about the process. So,
yeah, the advocacy is certainly for expediting the process for everyone, and everybody wants to get in line, and we certainly want to support our frontline workers, our first responders, our teachers, and it feels like they're listening. They're hearing where the glitches are in both systems, both the call-in and the online registration, and they're trying quickly to fix those problems so that they can get everybody through. And I understand that the next clinic in Squamish is on the 27th. There's one in Whistler on the 28th and one in Pemberton on the 29th, if I'm not mistaken. So it's exciting. It's important to share with your networks that these are available and that we can make this pandemic go away. Go ahead, Director Elliott.
I just wanted to say that we have Astrazeneca clinics in Squamish on Friday, Saturday, and Sunday for 40 plus people because we were on a list of hotspots. And so we got a special allocation of doses and times. So we've had really good uptake so far, which is great to see. So with the folks that work in Whistler that live in Squamish getting vaccinated in Whistler, and now this group that will be eligible sooner than they would have otherwise, I'm hopeful that we will stop being a corridor that is a hotspot in the province in the next couple of weeks.
Hear, hear. Any other comments or anything else to add to the verbal report? Okay. Are we changing links at this juncture to go into closed, or are you just taking the feed off the YouTube live?
Thank you, Chair. We do have a separate link set up for the closed meeting.
Okay.
Haven't we got a validation or something?
We do, but it's for the closed. So why don't we go ahead to 9.1 and receive the letter for correspondence? Go ahead, Director Clark.
Thanks, Chair. Can we have a motion to receive the chair's verbal first, please? Thanks.
Moved by Director Elliott, seconded by Director Rainbow. Anyone opposed? Motion carries. And then can I have someone move receipt of the letter? Well, she's asking for our advocacy. I think that this letter was written before a lot of this work has been done to move these vaccine clinics along. So I feel like we can just receive it for information. Anyone agree to that? Moved by Director Jewett, seconded by Director Richmond. Further discussion?
Does she get a response?
Will she get a response, CAO Helmer?
Thank you, Chair. We can make sure that we do advise her of that. Yes.
Thank you. Okay. I'll call a question. Is there anyone opposed? Motion carries. And then there's correspondence for information from the Peace River Regional Hospital District. And we received one like this not too long ago, I feel like. Am I right about that? I feel like this one's been circulating around all of my tables, so I'm getting confused. But essentially, it's reallocating funding that to bring us in line with how Metro Van gets their funding through their to support their transit comes to in lieu of their hospital district fees. Am I right about that? I've read the letter too many times.
Thank you, Chair. I think that the big thing that they're saying is that the province is using some of the local government's taxation ability for funding these initiatives that should be handled at the provincial level. And that if that capacity were available to us, it could be used for other things. They're looking at transit, but it could be used for other taxation purposes as determined by the local governments.
Right. Any questions? Go ahead, Director Elliott.
To me, this is part of the larger conversation, which I believe UBCM has initiated with the Minister of Finance around how we fund local government. And so I don't know whether we specifically, want to support this effort or just generally support it in the spirit, if we write a letter saying, this is an important conversation. It's all about how we sustainably fund local government. And this is another example about, where there isn't necessarily equity or a consideration for how it impacts the whole province. So I'm I feel like this is a symptom of a broader issue. So I am don't need to respond to this, but definitely think we should be advocating on the bigger picture thing.
Agreed. Thank you. And there is a working group at UBCM that works on this pretty much exclusively. So thank you. Okay, so move receipt was moved by Director Elliott, seconded by Director Jewett. Call the question. Anyone opposed? Motion carries. Is there any late business? Seeing none. Are there any notice of, oh, go ahead, Director Stoner.
I was just curious if we need, I don't think we had a motion for 7.2. Are we coming back to that?
7.2, yes, we're coming back to that. Aren't we? We're doing that. Yeah.
Yes, thank you, Chair. I think we're going to do the motion to go in camera recess and then come back to that.
Okay. Okay. Could I have a motion to go into closed? Moved by Director Rainbow, seconded by Director Stoner. Anyone opposed? Motion carries.